from a biological standpoint, there are numerous factors and numerous agents in the oral cavity itself that is shown to be communicating with different parts of our body. Recently, there was research showing that the oral bacteria and microbiome in the oral cavity communicates with the microbiome in the gut and other parts of the body, which in turn is connected back to the brain. So it is a cycle that everybody, it's like a WhatsApp messenger. All the bacteria have a WhatsApp group and they all communicate through that group, by communicating signals from mouth to gut to brain to, from different parts of the body. So we're all connected together. Even though we are oral healthcare professionals, we come under one single body. We all treat the same, a person as a whole. That's why whole body healthcare is very, very important, and the entire alignment of oral healthcare to mental healthcare to general well-being or general healthcare is always connected together. Oral health condition or oral health signs and symptoms have shown to depict certain hidden medical conditions. For example, I was involved in the care of one of our patients who was complaining of persistent pain in the oral cavity, and after seeing several dentists and after getting several care, the pain did not dissipate, and on examination we suspected that the pain could not be coming from the oral cavity itself, even though the pain is occurring in the oral cavity or inside the mouth, in the gums close to the teeth, but it is not the origin of the pain. So we call it as a non-odontogenic pain. That means non-tooth origin pain. So these kind of pain conditions do occur time to time in certain group of individuals, and we just need to be vigilant to find out what is the actual or the real source of pain. In this particular patient, when we evaluated, we suspected that something is going on in the entire pain processing center in the body, which is your brain. So when we imaged, when we did the scan of the brain, and we were able to find that there was a small tumor growing in the brain, especially close to the area where the nerves are coming out, supplying the sensation in the face. And because of that, patient has been having a lot of pain and discomfort, and we were lucky enough to see that patient and guide that patient and diagnose that particular problem. And that gave us an opportunity to talk to our colleagues, and then we were able to move to the right medical specialty for a surgical procedure, and after that the patient was able to get absolute relief of pain. There are so many conditions that occur in the oral cavity can signify significant medical conditions. For example, cancers. So different types of cancers occur in the oral cavity. It could be an oral cancer, or it could be a cancer in another part of the body that has a symptom or a sign in the oral cavity. So we've seen patients having tumors in other parts of the body, like tumors in the lung, but then they have a small a condition or a lesion or an ulcer occurring in the tongue or in the floor of the mouth, and then when we try to investigate that, when we find out that that's not the true source of the cancer, but the true source of the cancer is in a different part of the body. With HIV/AIDS, they can present with a very unique type of cancer in the oral cavity called as Kaposi sarcoma. It's a very different type. It's like a purplish blue hue that comes, and especially we actually published a paper recently during COVID. We had a very, very big challenge in patients reaching to their healthcare provider, be it an oral healthcare provider or even a general healthcare provider. So we had a young patient who was diagnosed with HIV condition, was not under proper medication due to the inability to reach to the provider, and the patient had, when they came for an oral health evaluation for taking out a tooth, we found out that the tissue color changed. It changed, instead of a very nice pink gum color, the patient had a purplish blue hue around that area. and then we took a small piece of tissue and we sent it for a biopsy, we call it, or a pathological evaluation under the microscope. It came out as an invasive cancer of the variant of Kaposi sarcoma. So it is very, and the other part was the Kaposi was not just in the oral cavity, it had spread to the other part of his body, it was spread to his lungs as well. So luckily we were able to find it. The first representation was in the oral cavity, but then the unhidden representation was in the lungs, and we were able to call up the physician, our medical colleagues, and immediately they were able to do a CT scan of the lungs, and they found metastasis, or we call it as a distant metastasis in other parts of the body. Typically in a hospital, like in a cancer center setting, in a tumor board, dentist is always a part of the committee. So like for example, when I trained in New Jersey, we have to sit for tumor boards for almost every Monday morning for the cases that they see, not only for diagnosis, also for post-treatment. So as dentists, we sit in those boards and we recommend our oncologist what kind of preparatory care we need to do.